So thank you, Premier. So as you said, we now have a total of 7 cases. 6 of them are presumptive, which means they have tested positive here at our Nova Scotia lab, and they're in the process of being confirmed at the national lab. And one of our presumptive cases has been returned back and confirmed as positive by the national lab. We continue to have large numbers of specimens that we're through our screening process that we're testing. We fully expect to see more positive tests as the days progress. Of these cases, one is related to travel. Their exposure was outside of the country. The other one was related to one of our previous cases. Public Health is continuing to do their work on following up on previous cases and on these new cases. People need to understand that we are an extensive work that goes in every time there's a case that we interview the individual, we talk with the family, we identify where the person has been, where other people might have been exposed, who their close contacts were, and all of those close contacts are then required to be self-isolated themselves. And we support them on a daily basis because along with part of self-isolation is monitoring their temperatures, and any of the contacts who become sick are then referred in for testing and seeing if they have COVID or not. I mention that because we're getting a lot of rumors and communities. Everybody seems to be out there trying to chase COVID and really trying to find out who in their neighborhood may be self-isolated because they think they might have traveled and trying to rat on their neighbor, if you will. That's not appropriate. Public Health is in control of our cases and our contacts. The vast majority of Nova Scotians who are coming into the province and are being asked to self-isolate for 14 days are doing that. There may be a few who are not, but rather than trying to be negative and trying to identify your neighbor, we really need people to come together as communities to work positively and cooperatively through that. How are we going to support each other through these times? As I said on Sunday, we don't want to approach the situation with fear. We need to approach the situation from a sense of caring for each other and a sense of community.
Thank you, Dr. Strang. I'll now ask Dr. Carr to speak on behalf of the Nova Scotia Health Authority.
Thank you, Premier, and good afternoon, ladies and gentlemen. So, the Nova Scotia Health Authority has been busy really since January preparing, looking at our pandemic plans and actually implementing those plans. During that period of time, we've essentially discontinued any kind of meetings and other work that was not singularly focused on getting our organization ready to deal with what we know is going to be a challenging time ahead. You know that we've established our assessment centers. We have plans in place in all of our regions to put secondary assessment centers in our communities. And really, at this point, I can tell you that we're ready to look after patients in our hospitals who will have COVID-19. We have a plan that's been established that will see patients being cohorted within our regional facilities, and a lot of work is underway to essentially establish and create capacity for that within the hospital system. Where possible, we've worked with many of our partners to move any patients who are in our acute care facilities who don't need to be there and who would be safer somewhere else. We've undertaken work across the province to try to move those patients to a safer place before we have COVID in our acute care facilities. And as of late last week, we directed our teams to essentially rapidly but safely start to wind down clinical activity. And as of tomorrow, the following measures will be in place. All elective outpatient visits will be canceled. Individuals will be contacted by services, and we will be shifting towards virtual strategies to look after our ongoing patients. Dialysis, chemotherapy, and radiation treatments will continue, as will mental health and addictions appointments. All non-urgent diagnostic imaging appointments will be rescheduled, and walk-in X-ray services will be suspended. Cancer care imaging, PET scans, other time-sensitive exams, anything that has immediate clinical urgency will continue on a case-by-case basis. All same-day admission and elective surgical procedures are postponed. Now, cancer and urgent or emergency procedures will continue. And essentially, as we're freeing up inpatient beds, we will be cohorting those beds and creating some spaces where we'll be looking after our future COVID patients. As I said, we have plans, protocols in place to look after that. Thank you.
Thank you, Dr. Carr. Now I'll ask Dr. Jangard to speak on behalf of the IWK.
Thank you, Premier. Good afternoon, everyone. At the IWK, we have been working with our partners, as you've heard, to do every appropriate step and to make every appropriate decision that we can to ensure the safety of our patients, their families, and of our clinical teams and staff. Over the last number of weeks, we have been focused on ways that we can look at building capacity at the IWK to maintain our ability to respond for the care needs that we anticipate coming with COVID-19 as well. Decisions to alter non-urgent services are very difficult to make, but it is the right decision to make at this time. And therefore, as of tomorrow, Wednesday, March the 18th, we will be suspending all non-urgent services at the IWK. For our women and pediatric population, this means all outpatient ambulatory clinic appointments and community visits will be limited to urgent care only. This includes our clinical travel clinics to other parts of Nova Scotia, New Brunswick, PEI, and Newfoundland. All elective surgeries will be canceled and rescheduled at a later date. Surgical procedures will be limited in the health center to urgent and emergent cases only. Patients and families who are scheduled to have these appointments, both for their surgeries and their outpatient appointments, will be contacted by the health center to discuss when their procedure will and can be rebooked. We do ask for the patients of our population and of our people while we do this over the next couple of days. For our mental health services and addiction services, we have suspended all group activities and group-based interventions. We will be limiting our face-to-face contact as we move to a virtual platform for many of our visits so that we can continue to serve our patients and families. All urgent care and emergent mental health and addiction services will continue. With these non-urgent services suspended, we can build some capacity, look at how we can utilize our healthcare staff within the IWK, and also possibly for our partners as times move forward in this situation. This is a place where we all need to work together. As our partners at NSHA, we have already canceled all meetings, all outside events that are held within the IWK. We have changed our visitor policies, and we'll be looking at ways in which we can decrease the traffic through the health center unless necessary. This is a really important part of the social distancing we as an organization can help with the population. Thank you.
Thank you, Dr. Jangard and Dr. Carr. I want to thank both of you, and I hope on behalf of all Nova Scotians express our great appreciation to the men and women that work in your organization who have been outstanding during this time of challenge, and we know that they'll be there for us and our families if needed in the coming weeks and months ahead. So thank you all very much. Again, I want to thank Nova Scotians who have been working very hard to ensure that we reduce the spread of this virus. It is, I've said many times, it literally is in our own hands. Continue to follow the proper hygiene that Dr. Strang has talked about many times. And if you've been out of the country, if you've been out of Canada, you must isolate for 14 days, no exception. It is absolutely that critical that you take those 14 days, not only to protect your own family, but quite honestly to protect our province, to ensure that we slow down the spread of this virus. All of us can do this. These are simple asks. When you think about what's happening around the world, these are very simple asks that are being asked of each one of us. Keep our hands clean, and if we've been out of the country, self-isolate for 14 days. That's not too much to ask when it talks about life and death and literally in parts of the world and in Canada now. That's what this is. Also today, effective today, we are limiting all public gatherings to no more than 50 people. As of Thursday, restaurants will only be able to do takeout, and all drinking establishments will be closed. Today, the Nova Scotia Liquor Corporation announced that it is reducing its operating hours to help prevent the spread. They will be from 10 to 11 will be for senior population, those with mobility issues in our province, and from 11 to 7 Monday to Saturday, they will be opened for regular customers and closed on Sunday. Effective tomorrow, Service Nova Scotia will close its access centres for 1 week in order to establish a new way to provide services that avoids contact. But in the meantime, online services will remain up and running. And we're extending the dates for driver's license renewals and vehicle registrations that expire in March, April, and May to the end of August. Again, I want to thank all Nova Scotians who continue to work and ensure that their loved ones, as they enter back into our province, who have been outside of Canada, that they self-isolate, and we together can ensure that our province manages this virus and ensures that those that have been in contact with it now come back to good health. We'll be happy to answer any questions that you may have.
To the two CEOs, I wonder if you can clarify what constitutes an urgent or an emergency case, and what's the difference between the two?
Thank you very much. I think it's a very good question, and yeah, we still have this kind of outmoded term of elective and non-elective, which really doesn't reflect what's going on in reality today. Most of the cases that we do need to be done, and so the simple answer is that decision is made by a clinician who is looking at the individual case in front of them and their patient. And it's a clinical determination, quite frankly, as to what constitutes something that is urgent or something that is emergent. As you would imagine, it usually relates to whether or not they feel that there's any undue risk to the patient in delaying that procedure. And if it can be delayed, it will be delayed.
I would also add to that, things that might not seem to be urgent when you think of it, there are also things that are time sensitive. You can't tell people to wait 2 weeks or 2 months to have their baby. So some of the care that we provide for our maternity services, although you would say, might not think of it as urgent, it is time sensitive. So there are a number of different kinds of populations. I use that as one example. And again, our clinicians, our doctors and our clinical staff have been working tirelessly over the last number of days looking at patient lists to help make those determinations.
How many beds would you expect this to free up? First Dr. Carr and then Dr. Yengard.
I think it's very difficult to give you an exact number of how many beds we expect to be freed up. Yeah, so it's challenging. I mean, it will be in the order of magnitude of several units worth of beds, which would be probably in a regional facility somewhere in the vicinity of 30 or so beds. But it is hard to sort of say precisely at this point in time how many beds that's going to be.
Unit is 30 beds?
It depends upon the hospital, to tell you the truth. I mean, a unit could be, generally speaking, they're around 32 beds.
Our units would be a little bit smaller than that. We're looking at freeing up capacity for somewhere around 25 to 28 spaces for patients that we would need to be seeing and taking care of in this fashion. The important thing that we're also freeing up, though, is staff. So physical spaces are one thing, the staff to take care of people in those are the other, and the discussion of how we can redeploy, working with all the right people, those staff to be available is important.
Can you talk about capacity a little more? How many ICU beds are there now, and what's the situation? We talked about the ventilators. What's the situation with radiologists? Are there enough of them? How many are there? What's the expectation moving forward?
So we have we operate 120 adult critical care beds in the system here in Nova Scotia, and our colleagues at the IWK would operate.
We have 7 pediatric intensive care, and we have another 40 neonatal intensive care beds that can be repurposed and reused.
The second part of your question, I think you said radiologists, but were you so radiologists are involved?
Well, the people who run the ventilating machines. And
Okay. Well, so thank you. No, so there would be a combination of intensivists or intensive care physicians, anesthesiologists have training to do that. So we have your question is.
We're about to get in a bunch of new ventilators. Do you have the staff to operate?
Yeah, the answer is yes, we do.
What are you hearing about what are you hearing about the ventilators, Premier? You did make the request. We would think that this would come forward rather quickly. Are you hearing anything from Ottawa about where they are on that?
No, there would have been a national order that would have been added to on the weekend, so we haven't received back from them exactly when they're here. We currently, though, I think Dr. Carr would be able to tell you approximately 240 ventilators in our system now, and I think at the IWK, Dr. Jangard, I'm not sure me.
We have 33.
In addition to that.
Yeah.
Premier, I'm wondering, Ontario earlier today declared a state of emergency. Are we close to that in this province, or what would you have to consider in order to make that step?
Right now, the orders that we need to execute, we can do under the public health issue with Dr. Strang and his team. We are still monitoring, working with our colleagues across the country. In some provinces are at different stages than others, but for us, the impact in order to shut this province down, we've been able to do it really with the order Dr. Strang is operating under. So at this point, it's not something that we're doing.
Premier, there's other jurisdictions have been realizing that people are going to lose their jobs, lose hours, etc. Are you prepared to prohibit evictions or rent increases in this time?
Yeah, we're working with our national partner right now. As you know, Minister Morneau will be out tomorrow, I believe the Prime Minister said, with some economic incentives. He's been dealing with our Finance Minister and Deputy Premier, as well as Minister McClellan has been dealing with his colleagues across the country. Minister Reagan has been working, and later in the week, we will lay out a suite of public policy positions that will respond to the very real needs that you're referring to.
If you declared a state of emergency, you could limit rent increases right now.
We don't believe we need to do a state of emergency. As I said, we will lay out public policy positions in the coming weeks, and they'll dovetail in with our national partner.
So you will not, at this point, prohibit evictions?
It'll be part of what I said when we lay out a policy, public policy at the end of the week. The national government is laying out some initiatives tomorrow that a number of our ministers have been working with that will dovetail public policy into it.
We'll take two more questions before we go to the phone. Go ahead, Global, and then Jean.
A question for Dr. Strang. Just back to the two new cases today. You mentioned one is international travel, and you mentioned another was in contact with other cases. I guess I'm just looking for clarification around some of these cases, where they've all been transmitted from, and what's the connection to them, or if any.
So, as I said, we've got two cases that or one case is a contact with another case. The other 6 cases have traveled in various parts of the world. We are, I guess, minimizing the amount of information on individual cases that we provide. We really, we're out of extreme caution about protecting privacy. I think what's important to Nova Scotians to know is, do we have cases? The number we have. It is important to know, for even in public health, where they might have been exposed, i.e., out of the country, another part of the country, or at some point within Nova Scotia.
Have any community transmitted cases then?
We do. None of our cases, any of our follow-up is indicating that they were spread what I would call general community spread. As I said, as we said yesterday, 2 of the cases had been exposed in situations where they have been exposed to people who had come in from other parts of the world.
Just a follow-up story to that. With the 7 cases, do we have any that are requiring ventilation right now? What is their status? Where are they?
None of our cases are hospitalized at this point.
We'll come to Jean. Go ahead.
Dr. Carr, off the top you said your hospital or your hospitals were ready to deal with patients. What gives you the confidence to say that?
Because our teams have been working flat out for 3 months, Jean, to get ready for this, and we have expertise, and those experts have been working extremely hard with our colleagues at the IWK to work through the details of previous plans. So we have the benefit of the plans that we developed during H1N1. we have the benefit of a lot of information, knowledge on best practice and evidence that is emerging on COVID-19. And our teams have literally been working in real time to take that information and translate that into treatment protocols, standard order sets, all the kinds of things that you need. And really mentally our teams are prepared that if we know that it's imminent, that we are going to have patients that are going to need to be in the hospital, and I think that we're ready to bring those patients in the hospital and provide them with care.
Can I just hear
Go ahead.
the same question from the IWK? Are you ready?
So I believe that we are ready. We do know from some of the evidence that has come out about COVID-19 around the world that this likely is a disease that will be less effective or less impactful on most children, most healthy children. We do know, however, that we have children that are at risk, and those children will be the ones we very much want to, just like our elderly, protect by keeping people away from things and keeping people away from them. This is the work that we do. We have just come through, actually, at the IWK, a very busy respiratory season where we've had, anywhere from 2 to 14 children admitted a night with other respiratory viruses, some of which have needed stepped up and intensive care. This is our day-to-day business. What we've done today by these announcements is giving ourselves a little bit more capacity to be able to do a little bit more, knowing that something quite different and unique is coming down our pathway. But we are ready.
We'll take one more question before we go to the phone lines.
Dr. Strang, I'm just wondering, the two new, I understand you don't want to specifically say what area of the province they are, I guess, but where are the two new presumptive cases in Halifax? And can you also confirm where the confirmed case of COVID-19 is in Nova Scotia?
So as I said, we're being extra cautious now around protecting people's private information, and so we're not going to be giving any specifics, even in regions of province or age. That really isn't relevant for Nova Scotians. They need to understand that public health, we have intensive work on each of these cases, identifying people who might have been exposed, as I explained earlier, and then working with them around self-isolation. We need to understand that we will get this disease across the province. So focusing on this area or that area doesn't matter. We need to come back to focusing on what people do to keep themselves safe, all the personal protective measures, what we're asking people to do to limit their contacts with others, and all the measures we're putting in place to do that. It's critically important we do that, so we actually, my clinical colleagues to my left, are actually have the capacity in their organizations to manage the disease that is coming their way. But if we don't do collectively as Nova Scotians what we all need to do, they will not be able to handle the flow. This is the time that we work together so we have clinic for those who will get ill and have other health care needs that need hospital care, will be able to get those care needed. I can't stress that strongly enough. It's our job together to preserve our health care system.
We'll go to the phone lines now. We'll take 3 questions from the phone lines. Go ahead.
Bill Martin here for Six Rivers News.
All right. Bill Martin, go ahead.
Dr. Strang, when you announced the first 3 cases in Nova Scotia, you advised that 2 were in HRM, 1 in Kings County. You just said that you're choosing now not to do that. But as one who lives in rural Nova Scotia, I think it would behoove you to let us know, at least on a regional basis, because that will add so much more strength to the need for social distancing and so on. But by not allowing us to know, people might get complacent thinking perhaps it's all in Halifax.
So we've talked with our privacy folks, and I'm going to beg to differ with you a bit. Everywhere, it doesn't matter where you live today, you've got to be prepared and be doing what we need to all do together, whether you know you have a case of COVID-19 in your community or not. Because if it's not here today, it's likely coming in the coming days. But now's the time to all do the things that we need to do across the province. And I think if we allow people to focus on where there is or is not a case, it actually gives a false sense of reassurance to people who may not yet have a case in their community.
We'll go back to the phone lines for one more question.
Timothy Gillespie, South Coast Today.
Go ahead.
The municipality of Shelburne sent out a news release today indicating a councillor for that municipality had returned from northern Italy for a ski trip. From that same region on February 29th, which was his date of leaving Italy, 17 people from a ski trip from the same region to living in Great Britain had been tested positive. The WHO had a risk level of changing it from high to very high. U.S. State Department had a level 3 risk. Canada had a level 2 risk indicated. This news release, and the counselor said that he contacted the Department of Health and was told that even given all of those situations, he was told he did not need to self-isolate, which is very surprising to me, and I haven't been able to get a straight message from any of the people I've talked to at the Department of Health. Can you explain how this person was given permission to be in the community without self-isolating, given the circumstances in northern Italy?
So a couple of things. I haven't been involved in this individual case. We know that that since on Sunday, at our press conference on Sunday, at that time, it became required that anybody who traveled outside of the province when they came back needed to self-isolate. There may be people who came back before that. Our order came into effect on Sunday, and so we're focused on moving forward. I think it's important that the vast majority of people are complying with self-isolation. So I think we got to not worry about the odd person here or there who may not be complying. If you are aware of somebody, as I said yesterday, have a conversation with them. It's about working collectively to support and protect each other. But let's not focus on the few who aren't. Let's focus on the vast majority who are and all the good things we are already happening and the good things we need to do moving forward.
Thanks, Timothy. We'll go back to the phone lines for one more question.
I need to ask a follow-up. The order that was issued yesterday about the requirement that people self-isolate, is that also affect the people who came into the province on the 29th, that they should now self-isolate, or do they not need to obey that order?
That order came into effect at whatever the press conference, the verbal order for me, there was about 3 o'clock on Sunday, March the 15th.
That's all the time we have for questions on the phone. Back to the room. 2 questions.
Premier McNeil, with the 50-person limit, how does that apply to shopping like stores, grocery stores, malls? How does that apply there?
So the general area where you would have the gathering, we're encouraging people that area to be less than 50 people in it. In some provinces, they've actually exempted shopping malls at this point, but we're really encouraging even shopping malls in the common area to do that down to 50 people. Many of those people will be going in and out of different stores. My advice, though, as we're talking to Nova Scotians, is to be home. This is critically important over the next weeks. That as we get an onslaught of people coming home from March break, a lot of our families who were down south are coming home early. In the next week to 10 days, we will see a lot of people returning into this province who are going to have to self-isolate. It is important that as individuals we have as little contact with one another as possible as this virus is out there. So my message to Nova Scotians is to be home with your families. Take this opportunity to find new and creative ways to connect with your loved ones. I think use the phone, use video, use any device you can to call those who are around the country to reconnect back in. Find new ways to socialize at home with your loved ones, but try to be out of the public as much as you can be.
Dr. Strang, PEI's one confirmed case apparently was on a cruise ship, and then she flew back from Toronto to Moncton on the 7th of March. That's now affecting 2 provinces, including New Brunswick. Was there anybody from Nova Scotia, or are we trying to find out if anybody from Nova Scotia was on that WestJet flight, March 7th?
So we have made the decision nationally that we're no longer going to be try to do contact tracing on planes. That's a hugely intensive piece of work, and what we're focusing on is instead is that anybody, this is the rationale, anybody who's traveled out of the country may have been exposed. That exposure could have been in an airport, could have been on a plane on your way home. That is then you self-isolate, and then if you get symptoms, a fever or new cough, you get into 811 for tested. So we would need to devote our public health resources to following up people in the country. It's very labor intensive to get the flight manifest and do all the work about people. And we're not seeing really, you look internationally, airplanes, we've had lots of cases of people traveling and being later confirmed being on an airplane. We have not seen really a lot of transmission on airplanes. So we need to focus our energy where it's necessary to have the greatest impact on identifying people, along with the measures of everybody. If you're coming back into the country, self-isolate for 14 days.
We'll take one last question.
You said yesterday that you're doing some shoe leather work, trying to trace people who may have been to some gatherings. I'm wondering if you can give us a sense of how many people you're trying to look for.
So I don't have the number that, so I use the term shoe leather epidemiology, and that means that this is detective work. It's our public health nurses and other people on the ground interviewing people. Where have you been? So we're in the process of identifying all our cases, where they have been, who they were in contact with, as much as possible. Even when there's large gatherings, we do that privately. So even if there's a large number of people, if we can get from the event organizers, and I'm just talking theoretically here, who all those people are, we will reach out to them privately and work with them. We only go public if that is the only way to appeal to people, if they may have been in a certain place at a certain time. So there's a lot of work that goes on that you never hear about, because we're able to identify and work with the people privately and put the right measures in place.
Last question, Deshaun, go ahead.
Just a short snapper for you, Mr. Strang. We know that the government recently, or not that long ago, gave pharmacists greater power to renew prescriptions. Is there any talk about expanding the number of drugs that they'll be able to renew without having to go back to a doctor?
I'm not directly involved in conversations. I know there are ongoing discussions within other people and my colleagues in the department, along with the College of Pharmacists, the Pharmacy Association of Nova Scotia.
Thanks for joining us today.
Thank you all very much, and we would very much appreciate the effort that all of you have been doing, is ensuring that the facts around this virus and what Nova Scotians need to do to protect themselves continues to get out to your listeners and your readers and viewers. So to our partners here, to the Nova Scotia Health Authority and the IWK, thank you. And again, on behalf of all of us, express our great appreciation to your healthcare teams who have been doing tremendous work, as you've said, not only in the last number of weeks, but for months. And we look forward to seeing you all tomorrow.